Greetings and salutations, comrades. Hope this finds you well. Quick shout out to the 2 Uber comrades supporting this channel, my content and Patreon, my partner. Thank you, Ressa, and Independent Left News. So I came across this story of how Merck, this drug manufacturer, bought the rights to this drug that treats COVID, and it was largely developed with U.S. taxpayer money to the tune of $35 million or so at Emory University. And then the rights to this drug were then sold to Merck, and it costs around $17, I believe, a pill. And they obviously, because, it's a for-profit company, Merck, they want to try to gouge, people in these countries as much as possible, where this drug that treats COVID and has shown decently promising results, I believe, diminishing hospitalizations by around 50%. So it costs about $17 for Merck to manufacture this drug that's, helpful to treat COVID. And I believe it's a course of five pills. Again, costs less than $20 for them to make, and they're selling it at the rate of $700 per treatment. Again, it was publicly funded, so the costs get, paid by the public, and then this private company gets to make just a shit ton of money off of, literally price gouging people in order to potentially, save their lives or lessen the impacts of COVID if they get it. Again, this is just another, example, the profit motive reigning supreme, fuck everybody else. Merck's got the corporate bottom line that they need to pad. The CEO probably needs a new private jet. The board of directors, need a 3rd or 4th vacation home. So, fuck everybody else. Let's, jack up the price of this this drug that treats COVID, exponentially. So again, the system is the sickness. Capitalism is the virus. The system is the sickness, as Richard Wolff likes to say. So let's check out this article. Again, it's just another example, another, industry that obviously needs to be nationalized and ran for the public good. Profit motive obviously needs to get out of healthcare, because again, it's not really healthcare if the profit motive is placed before people's health, which is what we have in the United States. One of the reasons we've had 700,000+ people die from COVID is because our for-profit healthcare system, right? So here we go. Merck COVID pill sold at 40 times what it cost to make. The COVID pill by Merck, found to have virus hospitalization as death rates, as I was alluding to earlier, would be sold in the U.S. at $700 per treatment, while costing $17.74 to produce. Molnupiravir, the COVID pill created by Merck via federal funding, would be priced up at 40 times what it costs to make for U.S. consumers. The pill needs a 5-day course similar to treatment of antibiotics, except this pill will be the first in the world to function as a COVID vaccine, despite inhalable options going through various stages of clinical trials. According to reporting from The Intercept, Molnupiravir will be sold at $712 per 5-day course. Jesus fucking Christ, right? A tiered pricing approach outside the U.S. This is from their PR. Merck is committed to providing timely access to Molnupiravir globally if it is authorized or approved, and plans to implement a tiered pricing approach based on World Bank. So again, that's just, corporate speak. So, this looks really bad that it only costs less than $18 to make, and it's, over $700 for this course of 5-day treatment. We want to obviously maximize the profit, fuck everybody else, but we want to make it not look at, like we're such horrible people. And then this other article from Axios talking about the same thing here. Again, not to single out Merck, this is just one example of many. The system is the sickness, as I like to say time and time again. You need to get the profit motive out of everything, out of all these industries, healthcare, education, pharmaceuticals, you know, et cetera, because we need a dictatorship of the proletariat where, you know, we have a rational planned, centrally planned economy that's designed to meet the needs of the masses and not designed to meet the needs of a very small elite capitalist class at the top, which is obviously what we have now. And this is just another, you know, disgusting example of that, right? So this is the same thing. The antiviral pill showed promising results against severe COVID-19. It was originally developed at Emory University with 35 million of taxpayer grants. Why it matters. The federal government consequently owns rights to some of the Molnupiravir patents, which could factor into future purchase agreements with Merck, but again, like, federal government usually just fucking rolls over and lets the pharmaceutical industries do whatever they want, because both, you know, political parties and these regulatory agencies completely bought and paid for by, you know, pharmaceutical industry, big pharma. Emory University researchers conducted early stage testing on Molnupiravir from 2013 to 2020 with funds from the National Institute of Health and Defense Department. So then they issued it a license to Ridgeback Biotherapeutics. Federal government, the Merck bought the exclusive rights to sell and manufacture the drug worldwide. Look at that. U.S. government paid $712 per treatment course in June. Each course requires patients to consume 40 pills over 5 days. So the government paid $17.80 per pill. Damn. But two researchers estimate Molnupiravir could be made at $20 per course or 50 cents per pill and still include a 10%. But again, it's not about meeting the needs of the people. It's not about helping the most vulnerable and marginalized, whether it be in the US or, you know, outside of the Imperial Core here. It's about maximizing profits. It's about making as much money as possible. All the externalities be damned, right? Jesus Christ. Even if one includes the cost of manufacturing the pills, a price 1/5, that 712 should be sufficient to serve. But again, it's not a reasonable, you know, return investment. It's about maximizing profit as much as possible. And if you don't do it, if Merck didn't do it, it would be the next company, and then they would be, you know, being beat out by these other pharmaceutical companies that would be, you know, willing to gouge the market even more. So again, the system is a sickness. We need to get rid of the capitalist system that puts profit over people's lives, people's well-being, the well-being of, you know, the planet. It's kind of important to have an inhabitable planet to live on, right? So again, not surprising, but still really, really disgusting and disturbing, right? Like the video if you like the damn video. Subscribe for more content. All part of the people. Peace.